This lecture discusses the anatomy of the heart. This is an anterior view of the heart. This is the surface of the heart, deep to the sternum and to the anterior ribs. We note that most of the anterior surface of the heart is formed by the right ventricle, and that the right border of the heart is formed by the right atrium, and the left border of the heart is formed by the left ventricle. The borders of the heart will become important to us later when we examine X-rays of the chest, where changes in the position or visibility of the borders may be diagnostically important. This is a posterior inferior view of the heart. We see that the left atrium is posterior, up against the vertebral column and the esophagus. The right and left ventricles sit on the diaphragm, forming what is called the diaphragmatic surface of the heart. This is a superior view of the heart. The pulmonary trunk, aorta, and atria have been removed in order to show the position of the valves of the heart. We see that the valves are close together because of embryologic development. Anteriorly, we see the aortic and pulmonary semilunar valves. And posteriorly, we see the atrioventricular valves. The tricuspid valve is on the right, and the bicuspid or mitral valve is on the left. This is an anterior view of the heart. The artist has drawn the arterial supply. We see that the arteries arise from the proximal aorta and run in the atrioventricular and interventricular grooves. The right coronary artery runs in the atrioventricular groove on the right and terminates posteriorly as the posterior interventricular artery. The left coronary artery divides into two main branches. The circumflex branch runs in the atrioventricular groove on the left, and the anterior interventricular branch, or left anterior descending, sometimes called simply the LAD, runs in the anterior interventricular groove, and it is the main blood supply of the left ventricle. This is a posterior view of the heart from below. It shows the cardiac blood returning through the coronary sinus to the right atrium. This is an interior view of the right atrium seen from the right. The superior vena cava drains in to the right atrium superiorly, and the inferior vena cava inferiorly. And adjacent to the opening of the inferior vena cava, we see the coronary sinus, where venous blood from the heart returns to the right atrium. We see the interior of the right atrium has both a smooth and a rough part. The smooth part is derived from embryonic veins which have been incorporated into the right atrium, and the rough part represents primitive heart. We see that there is a junction between the smooth and rough parts called the crista terminalis. The fossa ovalis is a small depression on the intraatrial septum between right and left atria. This is a remnant of an embryologic structure, the foramen ovale, which allows placental blood to pass from the right heart to the left heart to reach the systemic circulation. We also see a glimpse of the tricuspid valve, or right atrioventricular valve, which connects the right atrium and the right ventricle. This is an anterior view of the interior of the right ventricle. We now see the tricuspid valve, and we see the chordae tendineae, commonly called the heartstrings, which connect the cusps of the valve to the papillary muscles. The papillary muscles act to keep the valve closed during contraction of the ventricle. We see the smooth outflow tract of the right atrium called the infundibulum, which leads to the pulmonary valve and the pulmonary trunk leading to the lungs. This is a view of the interior of the heart from the left. We see the thick left ventricular walls. We see the mitral valve and its papillary muscles and chordae tendineae. The mitral valve connects left atrium, and left ventricle. On the right, the mitral valve has been removed and the left atrium exposed in order to get a better view of the aortic valve, which leads to the aorta and the systemic circulation. We return to this superior view of the heart with the atria removed and the pulmonary and aortic vessels removed at their base. We see that the aortic and pulmonary semilunar valves are anterior, and that the atrioventricular, the tricuspid and mitral valves, are posterior. This view shows the position of the valves in systole when the ventricles are contracting. The aortic pulmonary valves are open to allow blood to flow to the pulmonary and systemic circulations, and the atrioventricular valves are closed. Closure of these valves produces what is called the S1 heart sound. This image shows the position of the valves in diastole when the ventricles are filling. We see the atrioventricular valves are open, and the pulmonary and aortic valves are closed by back pressure. Closure of these valves produces what is called the S2 heart sound. This is a schematic representation of the cardiac conduction system. The heartbeat is initiated by a pacemaker in the right atrium called the sinoatrial node, or SA node. From the SA node, excitation spreads along the walls of the right and left atria to reach the atrioventricular node, or AV node. From the AV node, excitation spreads along the bundle of His, which divides into right and left bundles, which travel along the interventricular septum in order to excite contraction of the ventricles. This would be a good time for you to review physical exam of the heart.